Hi, my name is Lord Cabhug, student number 3031370. I'm currently taking the PN program course in FDN 1002, and I will be showing you how to properly put an elastic stocking to a patient. So the first thing you need to do is to uh, do some hand hygiene, then to provide some patient with some privacy. Then you review the doctor's orders to see if the patient does need a change in the elastic stocking or like to continue the elastic stocking or not. Sorry. So I'm going to be introducing myself. Hi, my name is Lord Cabahug, student number 3031370, and I will now ask the patient for two identifiers, such as their name and birth date. So Miss Catherine, what is your first and last name and your date of birth? All right, thank you so much. Now I will be asking consent from the patient to do a set of vitals, asking for her BP, pulse rate, temperature, SpO2, and then do a pain assessment if necessary. Also, I will be doing uh, uh, an integumentary assessment on the client's affected area on her lower extremities to see if there's any scratches. I'm going to be checking for warmth, edema, and also I will also be checking or assessing her popliteal and dorsalis pedis pulses just to see if everything is clear. Because and I will educate the patient that the stocking is used to help circulation on her lower extremities, on her lower extremities. So before I do anything else, I'm going to adjust the bed to a comfortable working height, put the side rails down, and I will be assessing the client's legs just to see if there's any scratches, any irregularities, any edema, if it's warm to touch, uh, color appropriate to ethnicity, and that. Then I will be measuring the stocking. So if it's thigh high, I will be measuring the stock. I will be measuring it from the heel to the gluteal fold over here on my dummy's butt. Well, if it's knee high, I will be measuring it from my client's heel to the popliteal here by the knee area, and I will be measuring the circumference of the calves for knee high, and I will be measuring the thigh for a thigh high one. Next, I will be bathing the legs if necessary, and I will be putting powder. It depends on the hospital that I work in. Next, I will get the stocking. I'll turn it inside out first. And now I will put it. I'm imagining this would be like knee high, knee high stocking. So I will be putting it in. As I'm doing this, I'm also educating the patient to that it is important for the stocking to like not be rolled over or to be removed without a medical professional's assistance. And this is as far as I can go with my dummy, sadly. So imagining this would be a thigh high, I am assessing the stocking to see if there's any wrinkles, to see if there's any sort of ridges in it, and if the doctor's orders require me to put two stockings, I will be doing that to the same leg. Of course, if the doctor requires me to put it like a thigh-high stocking, I will do that. But sadly, this is only the as far as I can get with my stocking, so I'll be removing it. And for following checkups, I will be removing the stocking to check if there's any scratches or if there's any damages or any screen breakdown that is happening on the client's leg. And I will document it appropriately and with my evaluation. Before I leave, I'm going to ask the client if they need anything else, put the bed to the lowest setting, make sure the side doors are up, call bells in place, and I'm going to do my last round of hand hygiene. Then I will leave the client and do the appropriate documentation, and that is how you apply an elastic stocking on a new client.